So, there are millions and millions of headache and migraine sufferers in the world, and most of them have tried so many different types of treatments, but often they've failed and you're left suffering and also wondering what's going on. So that's what we're discussing today. Why has treatment failed? Hi, I'm Dr Beth, an osteopath here at Melbourne Headache Solutions, and joining me today is Dr Rick, an osteopath at Premier Sports and Spinal Medicine. Thanks for joining me today, Rick.
Absolute pleasure, great to be here.
Awesome. So, we know that the underlying disorder in a headache and a migraine is due to brainstem sensitization or central sensitization, and that's basically leaving people feeling like they're a headache and a migraine waiting to happen 24/7. So, because of this central sensitization, there are many factors that can contribute to this and lead to this sensitization.
Absolutely.
So, two of the really common ones are upper neck problems or upper neck dysfunctions. And another really common one is stress. So we're talking about physical and emotional stress. But what are some of the other really common factors?
Okay, some of the common factors that you guys out there might have also experienced are things like the dietary triggers, the composition of your diet, the nutrients that they contain or lack thereof, and there's also these immune reactions to certain foods that seem to just trigger us off. As well as diet, there's simple things like the hydration levels. If you're dehydrated, we know that that can sometimes be something that can precipitate headache. There are also other factors such as the health of your gastrointestinal tract or your gut. And unless you've been living in a cave for the last 5 years or so, you've probably read a lot about gut health and how it influences our overall health. But there's also quite a bit of research now showing how the composition of your gut bacteria, how well you digest food, and the integrity of your gut lining can actually affect your systemic health, including your brain, and it may actually also influence your susceptibility to headache and migraine. Some of you out there might also be familiar with migraines related to the menstrual cycle. So we know that there are also a lot of hormonal factors that can also influence our brainstem's sensitivity. Numerous other lifestyle factors such as the amount and quality of sleep that you get or lack of, and habits like your alcohol consumption, your smoking habits, and perhaps even the amount of physical exercise you do, all kind of potentially influence your susceptibility.
Yeah, hormone headache and migraine sufferers are a really big component of the patients that we see in the clinic. Yeah. So really common there. And sleep problems definitely contribute to headache and migraines on a massive level.
Yeah.
So with all of the things that we've just mentioned, neck problems, sleep, hormones, all those sorts of things, gut problems, a lot of patients have tried so many things to try to treat their headaches and migraines, including changing their diet, looking into contraceptives to control their hormones. They've tried neck treatments, they've tried maybe even a couple of yoga classes to control their stress. They've tried all sorts of things, and yet they're still suffering. That's why they're listening to us.
Yeah.
So what have they missed? Why has treatment failed?
Yeah, that's a really good question, and I know it's frustrating for people out there who've tried all sorts of things but just haven't quite seen the results that they're expecting, and we definitely feel for you. But I think in a lot of cases, people are doing a lot of the right things, but they might just not be doing the exact right thing for them. They might not be following the right diet, for example. They've been trying to remove certain foods, but perhaps they haven't quite identified the trigger for them. And that might be a bit more of an involved process to be more specific. They might also be doing the right thing, but they haven't quite done it for long enough, and they haven't given enough time for the effects to really manifest. And sometimes people, because we're all entitled to having more than one thing going on at once, you might find that there's actually a combination of things that are contributing to your symptoms. And by removing just one of those things doesn't quite give you the symptom relief that you would like. It often requires perhaps looking at multiple things simultaneously. So you may need to address the mechanical factors of your neck, the influences of dietary triggers. Potentially there might be some gut stuff going on as well, and perhaps the stress that you're going through is all having a combinatorial type of effect. So if you're struggling and you haven't quite found the exact approach that's working for you, don't lose hope. What you really need is somebody that can help you navigate the complexity of all the possibilities there and be much more specific and tailored to your individual situation.
So, like for example, then some people, like with their diet, they might have just started removing a couple of things because they might have suspected gluten, for instance. So they might have removed gluten, and that. But if it was just gluten, then that might have not have helped. They might have needed to be more specific and removed quite a lot of things, gone on a full elimination diet, and that to really be specific. And that, so they might need someone to help them with that. Or alternatively, sometimes when people go on supplements, then they're not on the right dosage, they haven't gone on it for the right length of time, and that, so after a couple of weeks they go, look, I haven't seen any results, and so they just give up. So it doesn't necessarily mean that those things aren't working, it just means you haven't done it for quite the right period of time. That's a very good point. Going back to the gluten as an example, so gluten sensitivity is a real thing, although it's quite a trendy, fashionable thing these days, and it does have quite a strong correlation with some headache presentations. In order to truly establish whether or not you do have an issue with gluten in the diet, you do have to remove it for quite a long period of time in order to give the body a chance to kind of reduce the antibodies that it develops. And we're talking about 30 days, maybe even 60 days duration. So some patients, they remove gluten from the diet for a week or two and they don't necessarily see the full effects, and they think that it can't be a gluten problem, that it's just that they haven't maybe attempted the dietary approach for a long enough period. That's a really good point. So the other things that are like really common that patients will do is that they'll go and get their neck treated in regards to their headaches and migraines, which is really good. That's a really good approach to take. But unfortunately, there's often a really important piece of treatment that's missed. So as we spoke about, brainstem sensitization, or that central sensitization, is the thing that actually keeps you staying as a headache and migraine sufferer. And most forms of manual therapy, they only treat neck pain. They don't actually get that central sensitization, which, as we just said, is the thing that's keeping you that headache and migraine to begin with. So you actually need a form of manual therapy that gets both pieces of that headache and migraine puzzle in order for anything to change.
Absolutely.
So that's where your manual therapy has actually gone wrong. That's where it's failed you. Okay. So, and also in regards to stress, I hear a lot of patients go, look, I am stressed, but it's actually my headaches and migraines that are causing me stress, that are causing my anxiety. But my doctor keeps telling me that it's my stress that is causing my headache. So it's kind of this vicious cycle that's happening. And although it can be true that stress can add to your headaches and migraines 100%, it is also true that if you do get rid of your headaches and migraines, you can also get rid of your stress as well. So if you have heard stress is the cause, you need to just decrease your stress. Don't worry, we know, we've heard it a lot. And yes, it is true that if you do get rid of your headaches and migraines, we're with you. You can also help to decrease your anxiety and your stress levels as well. We're with you there. So a lot of people have also tried a lot of mainstream medicine. So they've tried medicines, they've tried preventative medications, they've tried Botox, because they need somewhere to go. And these have often failed them as well, because again, they're still getting their headaches and migraines. And that's because mainstream medicine really only has medication to offer, isn't that right?
And a lot of the time it's focused on suppressing symptoms to provide relief. And don't get me wrong, relief is important when you're having a lot of symptoms. But these things often fail, or they only provide temporary relief, because they don't necessarily address the underlying mechanisms that drive the problem in the first place. And we know that the primary driver for migraines and other headaches is brainstem sensitization, and we really need to just appreciate all the factors that can actually contribute to that.
So you really need to get to the cause in order for anything to change, rather than just putting a little band-aid over it. Because often you'll see with these medicines that if something does change, it changes in the beginning, but often your body will get used to it, and then your symptoms start to come back, which again, obviously is not what you want. So in terms of actually finding relief, in terms of actually finding the changes that you want to see and not having failed treatment, what are we going to do, Rick? How do we help these people?
Well, first of all, you need to have a thorough examination and a good assessment that looks at the big picture perspective. For example, at Premier Sports and Spinal Medicine, we sit down with patients. Melbourne Headache Solutions as well. We take the time to listen to the patient. We perform a thorough and detailed case history, looking at all of the potential components, This includes the appropriate physical examinations, and we then formulate a customised treatment plan.
Yeah, exactly right. So we really want to get to the cause of your problem, okay? We don't just want to put a band-aid over it. That's not what we want. We really want to get to the cause of what's happening so that you can get to those long-term solutions, get to that long-term relief that you haven't found with the rest of your treatments. We don't want to be another one along that saga of failed treatment, okay? So we hope that you found what we've said interesting today, and we hope that you found it helpful. If you have, please share this video. Please spread it along with all of your other friends and family so that they can also find benefit with it. Also, we really want to help you find your long-term solutions. So if you want to get started on your journey today towards finding those long-term solutions, please comment either headache or migraine below so that we can get you started on your journey today. Thank you so much for joining me today, Rick. It's been a pleasure.
It's been really great. And one thing I'll say just to finish up is keep an eye out for more videos like this to come, because we're going to spend a bit of time elaborating on each of those other factors in more detail to hopefully get you on the pathway to success.
Absolutely. Thanks, guys.
Right.
We'll catch you next time.
Bye.